So when should you go see a doctor if you think you have COVID? How bad should the symptoms be? As you heard, Governor Abbott is counting on an antibody treatment, keeping many Texans out of the hospital.
You know, it's getting tricky to know what to do and when. 12 News reporter Jordan James asked a doctor tonight.
Dr. Minnie, let's get right to it. What should you do if you have someone in your house who tests positive for COVID-19?
Try and physically distance yourself. If you know that person has COVID and you don't, if you can wear masks in your house, wear masks, just like out in public. And then good hand washing, right? Good hand washing. And then in your house, it's like cleaning all the surfaces, right? Sanitizing your doorknobs, sanitizing counters.
Would you recommend people just showing up to the doctor if they feel like their symptoms have gotten worse?
First thing would be call your physician, see how they want you to come into their office. Some have you coming in, some are still doing telemedicine, some have patients come at the end of the day. So every physician's different.
Over the last few weeks, we have seen an increase in our hospitalization. Why do you think that's happening? And do you believe that people are waiting too long to get help?
And I believe a lot of that is because they've avoided going to the hospital earlier on, or they've avoided going to their doctor for their routine screening, people that have other medical conditions. So now when they finally get to that point where they have to come to the hospital, their acuity is much higher.
So flu season is here. What are the advantages of getting a flu vaccine during the pandemic?
Having flu and COVID at the same time obviously increases your risk for bad outcomes. Flu vaccine doesn't mean you may not get the flu, but it works by either if you do get the flu, it should be less severe.
And finally, what are some things that we should keep doing to reduce our chances of catching COVID-19?
You're wearing a mask, you wear it properly, you physically distance, you get good hand hygiene, and then staying out of big crowds. We know that works. We've seen it work.
Dr. Minnie and other health experts are strongly discouraging gathering for the Thanksgiving holiday. We've also heard that the CDC is advising against traveling for the Thanksgiving holiday as well. Reporting here in Beaumont, Jordan James, 12 News.